Type 2 diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is a lifelong condition that affects our body's ability to process blood glucose. In particular, type 2 diabetes affects the way that our body uses insulin, which is a hormone that is produced by the beta cells of the pancreas. Under normal conditions, insulin secreted by the beta cells is highly sensitive to changes in blood glucose levels. So when blood glucose level increases, insulin level also increases. And when blood glucose level decreases, insulin level also decreases. In people with type 2 diabetes, the body continues to produce endogenous insulin. However, the amount of insulin that is produced is either insufficient or not efficiently used by the cells. There are three major abnormalities that contribute to the development of type 2 diabetes. To begin, let's start with insulin resistance. In this case, the insulin receptors located on the skeletal muscle, fat, and liver cells do not respond to insulin that is produced by the pancreas. This is due to the receptors being unresponsive or because they are insufficient in number. Because insulin is not properly being utilized by the cells in the body, it results in increased blood glucose levels. To compensate, the pancreas then produces even larger amounts of insulin. Decreased beta cell function. As the condition progresses, the beta cells of the pancreas either becomes fatigued from producing large amounts of insulin, or the beta mast cell is lost. Both these conditions result in decreased insulin production. The third abnormality is improper glucose production and glucose release by the liver. Instead of releasing appropriate levels of glucose to match the body's needs, the liver fails to regulate the proper release of glucose. Increased secretion of glucagon from the alpha cells of the pancreas also promote glucose production from the liver, which then further leads to hyperglycemia. Signs and symptoms. Polyuria. Because of excess sugar in the blood, the kidney fails to absorb and filter the sugar molecules. This results in sugar being excreted in the urine. Polydipsia. Because of frequent urination, this leads to dehydration. To prevent this, a person with type 2 diabetes drinks more water to compensate, which again contributes to more urination. Polyphagia. Because the glucose is not getting into the cells cannot utilize these molecules for energy. This lack of energy then leads to increased hunger. In addition to these three symptoms, individuals also tend to be fatigued, have recurrent infections, weight gain, prolonged wound healing, as well as visual acuity changes. Diagnostic test. Type 2 diabetes can be diagnosed through many techniques. The A1C test, also known as glycosylated hemoglobin test, is a blood test that can be used to determine the blood glucose levels over the past 3 months. An A1C of 6.5% or higher means that 6.5% of total hemoglobin has glucose attached to it. Fasting plasma glucose level measures your blood glucose level at one single point in time. The more reliable results are achieved when the person has fasted for over 8 hours prior to a test being conducted. The 2-hour plasma glucose level test is where the plasma glucose levels are tested 2 hours after consuming a glucose solution. Nursing intervention. Nutritional therapy, exercise, self-monitoring of blood glucose, and drug therapy are used for the management of type 2 diabetes. Oral hypoglycemics are also used to improve the ways in which the body produces and uses insulin. In terms of drug therapy, oral hypoglycemics such as biguanides, sulfonylureas, meglintides, alpha glucosidase inhibitors, and DPP-4 inhibitors are used. These drugs work to reduce glucose production by the liver, increase insulin sensitivity at the tissue level, or increase insulin production. Complications. One complication associated with type 2 diabetes is hyperosmolar hyperglycemic state. Because blood glucose can climb to high levels, this can cause increased serum osmolarity, neurological manifestations such as coma, seizures, and aphasia. Other chronic conditions include angiopathy or damage to the blood vessels, retinopathy or damage to the blood vessels in the retina, sensory neuropathy, and complications of the foot and lower extremities, such as loss of sensation to the lower extremities and increased risk for lower limb amputations. In terms of long-term prognosis, type 2 diabetes is a chronic condition managed with lifestyle changes and drug therapies. Life expectancy may be shortened by up to 5 to 10 years.